Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California.
So parenting is truly, definitely for me, the hardest thing to do. And if you add on top of the already extremely difficult situation that parenting is, a really deeply feeling, impulsive or reactive, explosive kid, that's just going to compound the difficulty.
So often parents come into the office and they ask, is this normal? I mean, I feel like I'm failing my kid and I'm trying things. I'm doing things that we're told to do. I'm doing the timeouts. I'm doing like the regular discipline strategies. And like maybe these worked before, but they're not working now. What am I doing wrong? Is it the kid? Is it me? What's going on?
Oh, yes. So I am so thrilled today to welcome Dr. Scott Akins to the podcast to talk about temperament, but specifically some of these more challenging, you may say, or reactive temperaments and some parenting tips around these kids.
Dr. Akins is the Chief of Developmental and Behavioral Pediatrics at the Mind Institute here at UC Davis, specializing in the care of children with neurodevelopmental disorders. Dr. Akins, thank you so much for being with us today.
Well, thanks, Dean and Lena. I'm so happy to be here, too. This is one of my favorite topics, and it's an area that many, many families struggle with, and certainly an area that we talk about in clinic with folks all the time.
Totally. And I'm not sure if I've mentioned this in prior recent episodes, but this year I'm doing a little bit of extra training specifically in developmental pediatrics. And I've had so much fun learning from Dr. Akins. But one conversation that he was having with a family that I was a part of really stuck out to me and made me want to ask him to come on for this. And it was parents of maybe like a 5 or 6 year old, super high energy kid, so smart, so fun, but really, really high highs, really low lows. The parents were constantly getting calls from school and his teachers for him misbehaving. So how do you describe these kids, Dr. Akins?
Usually as someone that I'm going to work for in the future, first of all, right? Like somebody has to run the world. And but I think, as a 5-year-old, we use terms like reactive or intense temperament. And those have been the medical terms that came out of the literature many, many years ago when we were first getting a handle on just different temperament types, that some kids might be a little more easygoing. Some kids might have strong and big reactions. But there's two terms that I like a lot better now that are used on by a wonderful organization called 0 to 3. That's a government-sponsored organization that does a lot of research in this area and provides great information for families. And they just say, big reactors and low reactors. And some kids have big feelings and are intense, place high demands on families, need a lot of input, so they're constantly on the go. They want high arousal activities. And other kids maybe have a little bit less strong reactions. But these kids are the big reactors, the ones we're talking about now.
Totally. And I think I remember you also sharing that you yourself had to parent a child like this. So I would love for you to tell us a little bit about your own parenting journey, some of the things that maybe you weren't prepared for when facing that, and some of the biggest things that you learned going through it.
Yeah, I mean, I always tell everybody this when I talk with families that have a child that is a big reactor, that is maybe struggling in daycare and struggling at home, and they're just really a challenge to parent. That our first child, who was born the year before I started medical school, or right before I was going to start, so we were 24, 25, was just so easy. Everything we did worked. Everything we read, he had literally his entire life, he had one time out for drawing on the couch, and it lasted, a minute and a half. And he was so sorry and ready to move right on and just really never gave us any trouble. So we thought we were really amazing parents. And then our second child, when we were in our mid-30s and both working really hard and taking care of our own sick parents and some other things as well, was really a big reactor, an intense guy like this. And like I always say, we thought we were really amazing parents for 12 years, and we found out we're all right. We're okay. And because for him, one, needed input all the time, just like you described, what we talked about a minute ago. the kind of guy that if you were starting to wrestle with him, he would yell, lay on me, throw me, just wanted input, pressure, constant movement. You could spend an hour at the park with them and get home and need 15 minutes to pay your bills or make dinner or, answer my email, whatever it might be. And 2 or 3 minutes later, he'd be asking, placing more demands, asking to do something else. And none of it was anything that was inappropriate for a 3-year-old. It was just constant, and constantly needing input and activity. And then the second thing is he was real resistant to direction. Really, even at 4, 5, or 6 years old, when he was first learning to do chores and things, if you would say, hey, classically, I remember this is one of the moments that really put me over the top. He was probably more like 7 or 8 when I said, hey, can you take the garbage out? And he turned and looked at me and said, by my first name, he said, Raj, I do what I want. And then just stared straight at me. So that took some nuance. And you can imagine, like, the image I have in my head of my reaction was just like pure Yosemite Sam, steam coming out my ears, red-faced, absolutely, frustrated, overwhelmed, and thinking the thoughts that most people think, like, if I had done that when I was a child, what would my father have done? How much trouble would I have been in? Is he doing this kind of thing at school? What does this mean for him long term? All of those kinds of worries that you have. And in truth, he was just a very self-directed, intense guy that looks for a lot of leadership opportunities. And when I figured out that all I had to say is, okay, great, is part of what you want to do, take out the garbage, he'd high-five me and take the garbage out and move on. And so that nuanced approach where he shifted a little bit from being direct and authoritarian to being relational and supportive, but still, he was still going to take the garbage out. That was going to happen. He was going to learn to do that. And then also praising him when he came back. Not a lot. For him, it would be more like, thanks for doing it. If you made too big of a deal out of it, he would feel that was artificial, and that wouldn't work for him either. But that was pretty subtle communication. And there were a lot of subtle adjustments that had to occur over time. But it all worked out great. And, everything that I could have hoped, developmentally for him all worked out. And he was the kind of guy that was needed a lot of activities, he plays viola, he plays violin, he plays piano. He was a captain of a soccer team and a captain of a baseball team. He had to be a catcher in baseball because it had to be constant input for him, that kind of but we just figured out those activities over time. And he's kind of busy from dawn to dusk and doing great in college. And, but he was an intense guy.
In this relationship, how do you know, like, is it me or is it like them? And, how do you figure that out? And in the end, does it really matter who it is? Because is it just all about the relationship anyway and trying to make it work?
Well, Dean, I really like that question because we all have, as I was kind of getting at a couple minutes ago, our own history of being parented and our expectations. And when we were first parents, my father lived with us, and that happens. A lot of families have grandparents or other family members living with them, and there are a whole series of expectations for how your parents think you should parent as well that can be challenging. And all of that kind of is a front load for every encounter we have with our children when they're misbehaving, especially if it's loud and it's confrontational and that kind of thing I just described at directly refusing to follow a pretty reasonable request. Yeah, so that's tricky. But I think if you start with temperament type, and it's part of why I love to talk about temperament, and think about what your child's needs are. And if we kind of just break out the big reactors and sort of as the group of kids we just talked about, and then slow to warm up, maybe a little bit shy, kids that need a little time to get warmed up, and then kids that have a mixed temperament and that can kind of present as both maybe more intense and reactive in a place where they're comfortable, but really slow to warm up and anxious when they're, in a new environment where they're uncomfortable. I like starting with that and then thinking through what my child needs for our relationship. And kind of back to the kids that I was most familiar with, my younger son, who would be my older son, who would be a little slow to warm up at times, but was pretty easygoing. You actually had to come up with high arousal activities to get him excited about something new, to get him to fully participate and engage. And so that was a whole different approach. And I think it's great if, as a parent, you get to understand your child's communication needs, their sensory needs, their strengths, especially, and then best you can adapt your approach. And I will say one other thing, Dean, like it's definitely your approach as a parent. It should be as consistent as possible. And what I mean by that is we like this style of parenting called authoritative parenting, where you're responsive, as I just described, but you have some basic rules around the house. We eat at a certain time and we all eat together. When it's time to get to the car to go to school in the morning, here's how we do it. We do it the same way every day. There's not a lot of negotiating. This is how we do it. And so we can kind of move through the day with reasonable expectations. And also things about, we do have chores in our house and everybody does them, and we don't, finish eating and leave our plate on the couch or whatever it might be, like that kind of things. All of that kind of structure is so important because you get out of the relational dynamics and it's just how it is. You spend less time negotiating, so you're more successful in the negotiations you have to have.
Totally. And I think it's important. I mean, I have a 2.5-year-old now, and I'm definitely seeing her temperament come through. She's definitely more like your oldest, like where she's a pretty easy kid overall. She's a little anxious and slow to warm up. But, for the most part, she's definitely learning to test her boundaries now and say no. And, I was screaming with her to put her clothes on this morning and she was running away from me. And, like just those kind of things. But you're right. Like I try to say, like, there are basic things that you have to do. Like I am your parent and I need to teach you these consistencies, right? So it's like exactly like you said, we eat together every night. We do all of these things. This is what you can expect. But I do wonder, as I see like her anxieties come out, if temperament seems to be fixed in kids, or is this something that can change over time? And then the other question I have, which you mentioned a little bit when it comes to like generational stuff, is how temperament is influenced by things like culture. Because one thing I've seen in my own practice, let's say like a parent comes from like an Asian culture where sort of like obedience and that type of thing may be more prevalent, and their kid maybe is a little bit more of a high reactor, but seems maybe more within normal realm to me. But the parents are like, no, this is out of control, or this doesn't fall within our cultural norms. How do you kind of parse that out?
Let me do that one first, and then we'll go back to the prior question. But yeah, I think that's really interesting, and it can be quite challenging because, just like you said, what people are really wanting to know is this within typical or normal development. But those norms are culturally defined, right? And they're different within different societies, and they've been different in the United States, decade to decade. We've had some differences in parenting style and expectations for youth to be able to express themselves and to really kind of place demands on adults. That's really changed, certainly within my lifetime. But in regard to culture, I do find that it's just really important to have open discussions with families about what their expectations are. And then for me to take a strengths-based approach and to talk about what I'm seeing in the child. An example would be that I saw not long ago and that we ended up talking about as a group within our developmental pediatrics group, was a young girl from a South Asian family that had very traditional values around girls being a bit more demure and quiet and respectful. And this was a very athletic, kind of go-getting, a little bit aggressive during sports and just expressive girl that, from my perspective, was just lovely and was likely to, like I said a few minutes ago, be a captain of this team or that team. But it made her mother especially very uncomfortable, and in part was what I was getting about a few minutes ago, because grandma lived with them and she was very uncomfortable, and that was just a challenging situation. So kind of talking that through in a strengths-based approach and thinking about maybe not the anxiety that you're feeling when your child's more exuberant in a social setting, but what opportunities could be available for her because she has these great leadership and communication skills. That's one approach that I've taken in the past. And then that is of course, something that families need to work out over time within the context of their culture as well. So it's good to have an ongoing discussion and just trying to support parents and seeing that strength. Does that make some sense?
Yeah, I love that.
And then we also know that in some cultures, authoritarian parenting, which is really more very strict rules. And again, certainly when I grew up, 50 years ago, this was pretty common. As maybe the most common approach to parenting, but very strict rules, strong consequences when you got in trouble, punishments that were anything from corporal punishment to you're grounded for a whole month, this kind of stuff, for relatively minor transgressions. We know that can still be a cultural norm as well. But the downside of that parenting approach and why, the evidence has encouraged us to help families move away from that is that, long term, we see a lot of social difficulties that can come out of children that are raised with that kind of approach. There can be resilience as well, but that can be challenging. So we sort of moved away from that.
And just for the listeners, like corporal punishment would be things like spanking or getting the belt. And we've done an episode on discipline specifically in the past where we highlight the data about why we know this doesn't work and why the American Academy of Pediatrics has a really strong stance on not using these kind of punishments for kids.
Right, and emphasizing the difference between authoritarian and authoritative.
Yeah, that's right. And it's funny. I wish they would have come up with terms that were, less similar to
Mhm.
describe those. But, we always teach our fellows, authoritarian is like an authoritarian government, not our preferred approach, and authoritative is that consistent rules we talked about before, but also getting to understand your child, working on a relationship that you can be happy about later. And for an example of that, just back to a personal example, my younger son, who I was telling you was so difficult, that's 19 now, we have a great relationship, and he's definitely one of the funniest people in my life, and sends me all kinds of funny texts, and has tons of interest. And it's interesting that we've been able to develop a relationship where I'm still involved as little as you are involved with the child, in their first year in college, with all those great activities. And I don't think that would have been the case with an authoritarian parenting style. I think he just would have had to reject that and separate because of how his personality is, and so it's good for you as a parent, long term as well.
So when parents come in with these concerns, a lot of times they want them fixed, but they also want like a diagnosis. Like, wait, there's something like wrong with my child. And so what is the diagnosis? Like, is it ADHD because they're like so active and have so much energy? Or do they have something else? Or, what is the underlying cause of this? What's the diagnosis? And they're often concerned about that. How do you tease that out?
It's another great question. So many of these kids with intense reactive temperaments do have some risk for ADHD, and we want to monitor them closely, whether they become clinical or not, meaning they need to participate in therapies or receive medication to be able to participate successfully in all the aspects of their life. That's some of the big predictors for whether you become clinical or not are, do you have supportive, authoritative parenting early on? And do you avoid negative and ineffective parenting, which is the negative part would be the spanking we were talking about before and severe punishments. And the ineffective piece would be where we just do a lot of negotiations and don't provide enough structure. And kids don't have that certainty they need within a structure to make good decisions. So there's that. And then the threshold, though, for making a diagnosis of ADHD is you have to have, we say, impairment. So you have to be really struggling and failing to a certain extent in 2 of 3 settings. And the 3 settings are school, home, and social. And social's things like every sport that you sign up for. If you did gymnastics when you were 5 and you just couldn't stand in line and you were asked to not come back and you weren't able to participate. If you didn't make it through Cub Scouts, even with a pretty flexible Cub Scout leader because you just constantly interrupted and you weren't safe to do certain activities, then that would be the kind of example of where you're really struggling in social settings. At home, it's the kind of, you said it, Lena, the big areas that we ask families about are how tough is it to get out of the house in the morning? Is it just impossible every single day? And is it a battle every day? And do you have to remind them 5, 6, 7 times to, grab their book bag? Then you get to the car and they run back to get their lunch, and you told them to get dressed, and you had to remind them to put their pants on, then their shoes on, then their shirt on, every step of the way. That can be really significant, inattention. And then if that's also happening at school, and kids aren't able to follow the basic routines, they can't transition between activities, they're having, frequent interrupting or blurting out, they're constantly on the go, and then they're struggling to complete academic work too, even though they appear to, cognitively be doing okay, then that's certainly, you'd meet criteria for diagnosis. And we'd want to move forward with treatments at that time. And just to be clear, the evidence-based treatments in kids less than 6, the American Academy of Pediatrics does not recommend medication in kids less than 6 unless there's really significant risk. The kind of kid that's, has had injuries from falling off the playground and then lost a tooth and then ran in traffic. That's a little different. We can talk about for very severe symptoms, but for the vast majority of youngsters that are 3, 4, 5, we want to engage in behavior treatments, which is really mostly caregiver coaching around learning to do the authoritative parenting that we're talking about and provide structure.
Absolutely. I think we've highlighted a lot of the common mistakes that parents make with these kids already, but, including, just doing the authoritarian style, not responding to your child's individual needs, maybe again, falling into that negotiation or screen time thing, oh, sure, if you do this, you can get a little bit of more of this, or the reward system where it goes too far. But are there any other kind of common mistakes or misconceptions that you see about responding to these behaviors?
I think increasingly I'll see parents that maybe had really strict parenting when they were growing up or had some authoritarian parenting, and they'll be very reluctant to provide a whole lot of structure or to provide any consequences for really negative behavior. And that comes from a loving place and from a place where you just don't want your child to experience, discomfort or pain, and you want them to be happy. But that can be really tricky because 3 and 4 year olds just don't have great judgment yet. And they generally don't know what they want minute to minute. And they don't know that, that it's nice to brush your teeth so you have teeth, things like that. They just don't know that yet. And so they're so focused on what's in front of them that if you're asking them, to make all the decisions, that's just not going to go well.
Yeah, I mean, and to be honest, as a young parent who engages in social media and stuff, the amount of push towards they're calling it gentle parenting.
Yeah.
It's a huge, huge thing that parents are seeing. Like, and to me, it can go a little bit too far. Like you said, like, yeah, your kid doesn't know that if they don't brush their teeth, they're not going to have teeth. Like, you are the adult and you have to teach them, right? Like in a developmentally supportive, loving way, they need boundaries and consistency and follow through. So yeah, I think there's a lot, probably, us not wanting to go too far if you had a more negative parenting experience yourself or how you were parented, but also like all this that you're constantly seeing on social media, comparing yourself to, this fake representation of what parenthood looks like online. It's all tough.
I think that's right, Lena. And so often, so many of the things that I'm talking about, they're not very exciting and they might not make it online. What I mean by that is, providing a consistent bedtime, everybody eating meals together, right? The value of doing things like board games with your children so they learn to take turns and wait for a little while and transition between activities. And you've heard me say transition several times. I mean, the skills most toddlers need are to be able to wait for a couple of minutes without getting really upset, to be able to communicate what their needs are, but also understand if we can't do what you want to do right now. Because again, if a toddler says, I want to go to the park, they don't understand the day's schedule. They don't understand competing pressures that you have where you have to, that again, you have to pick somebody else up in a few minutes, or you've got to go to your mom's house, or you've got to go grocery shopping. They just don't know all of that. So learning to wait and to hear no and to know that you'll go later, those kinds of things I think are really critical skills. But right, they're not really what you see on social media a lot. They don't fit in that kind of nice context of that you want to be a loving, supportive, ever-present parent and everything will work out great.
You've given us some real good examples of authoritative styles and how to respond. Could you walk us through, again, just like one specific issue? So we've talked before about like the toddler who won't get dressed and, it's like it's time to leave. And they just won't get dressed, and they're trying to negotiate, and they're trying to, and it 6 out of 7 days, you can't get out of the house in the morning. So the parent is struggling with this, and they're in your office, and they're about to break down and cry, or maybe they've already started crying. And, how do they start? How do you tell them to start to like shift this and change it?
That's another great example, Dean, and thanks for that question, because that's probably the most common concern that we have for families. Because, at 8 a.m., if you have to be at work and your child has to be dropped off at 7:45 at school, there are real time pressures during that time, and there are real consequences if you're late to work every day and if your child's late for school every day. And so it's a little more pressure-packed than some of the other parts of the day where maybe you can be more flexible and allow a little more time. So the couple things. One is I really do try to talk with them about their child's temperament type and needs so that they get a better understanding about some strategies that might be effective. The second thing is a lot of them are just really practical. If we make a list of what you need to get out the door in the morning, and if it's backpacks at the door with lunches in them, and then my work stuff, what I need, my backpack loaded or my work bag loaded, and then honestly think through how long that's going to take. And what your rising time has to be, and what time you're going to get up in the morning, and what you can do the night before. That can make a huge difference. It's just a starting point, because sometimes families in the morning are, one parent's making breakfast, the other parent had already left at 5 a.m. They've got 3 kids who are trying to get out the door. They haven't done any of those things the night before. They haven't packed lunches, and they're relying on their 8-year-old with ADHD to successfully make their lunch every day. And it's just not a good strategy. So sometimes we can decrease the overall stress level by just knocking some of that stuff out the night before and getting organizational skills in place. Interestingly, a lot of our work around ADHD is helping families with or children with organizational skills, whether it's study skills or just life skills like that, and then executive function skills. So setting priorities. There's 15 things to do this morning. What order do I put them in? What do I do first? What can I miss this morning? What has to be done? So that kind of thing. So that's very basic, so eliminating the amount of stressors in the first place. Sometimes it's getting up and getting started a little bit earlier. And then the other things we can do is just try to do it the same way every day. So there's not a lot of negotiation. If the two of you guys, I have 2 kids. If my strategy is I'm downstairs yelling upstairs for them to get their clothes on and they don't do it. And they're on video games already, or they have phones out already. That's just not going to work. My day might have to start. We might set a chart up that describes how the day will be, but I just might need to go in and sit with them until they get dressed. And then when they come down and they sit at the table and eat, and it might need to be 2 that I don't need to make a big breakfast every morning. They're going to have toaster waffles and a bowl of cereal, and that's going to be what we can do right now, and that's okay, and then so kind of eliminating some of those stressors, having a very consistent structure, and then thinking about what we need to do. Over time, we like to do that in a skills-based way too. There's pretty good evidence for using behavior charts, and so if the objective was to get dressed on your own, and for your 6 or 7-year-old to get dressed on their own, or their 5-year-old too, you might make a simple chart that has the steps, pants, shirt, shoes. Or you might say they're not great at doing their shoes right now. I just want to do their pants and shirt. And once they do their pants and shirt, they make a check and then they come down. What we want to get away from is a lot of constant reminders, especially if you're not in the same room, me yelling upstairs, "Are you dressed right? I told you to get dressed," kind of over and over. It's just that when we get into that ineffective parenting, that's what we're talking about. Some of that. It just doesn't work. It's not a great approach.
Dr. Lena and I have talked a lot about structure, and I think almost every podcast we're saying, one of the most important things you can provide for your child is structure, and make sure that you have a routine and structure. And we're no matter what the episode's about, it could be on anything, whether it's like food or whatever, but we're always saying routine is really important. So how would you rank routine and structure for reducing meltdowns and outbursts? Is that like the main strategy? Are there others that you would suggest?
Yeah, I'd put it right at the top, especially if what the meltdowns are about are these intense, reactive, self-directed kids, the guy that says, I do what I want, that are negotiating all the time and that fight for everything in the moment. Like, I want to do this right now. I don't want to stop watching TV. I don't want to give up my video game. I don't want to go outside. But then you move on to the next thing and they're fine. You go outside and you're in the car, they're fine. That's a guy you don't want to negotiate with all day long. It's a terrible strategy. And so if your routine is just that, like I said before, you get dressed, then you come downstairs, then you sit at the table, then you eat breakfast, then you walk over, grab your backpack, get in the car, and there's something you want in the car. Like, I think it'd be totally fine if the struggle is to get in the car, that if they are going to get any screen time, that you give 5 minutes or 10 minutes screen time on the ride to school. If that's what helps you get to the car, and that's your incentive for getting through the morning and doing everything right, completely fine to do that if that's the routine. Because then there's something in it, for your 5-year-old too, at the end of that routine. The routine makes more sense for them. So, I love structure, and we talk about it a lot. We need to be flexible because all of us, if you have a house of 3 kids right now and 2 working parents, you've got a lot going on. It might not be that, there are periods of the day that are going to be unstructured as well. But yeah, I'd rank it right up at the top.
This is a great place to stop for our episode today. In the episode in 2 weeks, we'll be continuing our conversation on temperament and parenting strategies with Dr. Scott Akins.
Yeah, so tune in then. That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter at Kids Considered.
And Instagram at Kids Considered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.